Okay, it's about 11:51. I think I told you earlier I got a transporter from my Uncle Jerry to borrow, which was my cousin Sally's husband's piece of equipment. There was a question on whether he could secure it in his van for transport, and he was carrying a wheelchair as a matter of practice in his van, which he could secure. So we put Susie in the wheelchair, and I'm bringing the transporter home, and we'll use it in the home as a wheelchair. So that's where we're at. It just seems like a super busy morning with DMV, and then all the paperwork and taking all the supplies that they'll give me and anything and everything. So we're on our way. We'll see how this unfolds. I do have a nurse coming tomorrow morning at 11. I don't know if she's going to do anything or this is an assessment. I have a feeling it's just an assessment call. And I think I've mentioned before, I want to engage them in me learning to do the transfers more effectively so that I'm not dependent on third parties for our transportation needs. Susie has an appointment with a new doctor, which will be her primary care physician, on the 20th of July. She has a therapy appointment at Valley Medical Rehab, not the one we were in. Ours was the acute rehab. This is outpatient rehab, and that's August 7th. And then she has an appointment at Valley Medical Center in that same rehab area that involves also a urologist, and that relates to her Foley catheter. And I don't know that I have a clear answer as to when they change the physical catheter inside her. But I was told today that the catheter bag is good for 2 to 3 days. Obviously you're emptying it and you're cleaning it, usually rinsing with water and a little bit of soap and rinsing it thoroughly and making sure it drains completely. And one of the nurse's assistants, Jessica, who's been fabulous, I asked her how often do the bags need to be replaced, not just changed from day to day. Like, I'm tag teaming between what they call the leg bag, which is what Susie has on right now, which is like out and about during the day. It's a lower profile bag, and then there's a bigger bag that will go up to 3 liters for like overnight. So the routine, she has an uncle that I think is paraplegic, and his routine is big bag on at 7 p.m., small bag on at 7 a.m. So kind of a 12-hour cycle for it. So they gave me some bags, so I need to check on my bag inventory to make sure that after 2 or 3 days I've got ample inventory to take care of putting on new bags. So anyway, and there's a whole logical process, like if you're putting on the bag, you're doing that before changing the diaper, because if there's urine that leaks out in the process of changing, you don't want to get it on a new diaper. I mean, all this stuff makes sense when they tell it to you, but sometimes when I'm in the middle of it, I'm drawing a blank. So I'm just going to write all this stuff down when I can, and kind of a checklist of a sequence. I deal best with that. It can be very rudimentary, but having a track to run on, even though I may know it all, it's just good. When I think of airplane pilots, they've been flying for years and they have checklists on all kinds of stuff. Of course, their stuff is a lot more involved than what I'm doing, but anyway. the adventure begins. So stay tuned, guys. Appreciate all the support. Take care.